Hey everybody, welcome. It's Jason Clemens, Doctor of Chiropractic at the Rock Health and Wellness Center, and this is Life with Jason Clemens, DC. We are live right here from the Rock Health and Wellness Center studios in Lubbock, Texas. We're on the radio at 98.7 Walk by Faith Radio at 1420 AM Lubbock Christian Nation. We're on 987radio.com. We're on all of our social media pages, and we're ready to go tonight. I hope everybody is doing good. Hope you didn't get caught up in any of these West Texas storms last night, and hope you guys had a good day. We had a good day here at the Rock, and tonight's going to be a really interesting show because we're going to have some conversations that I'm not exactly sure exactly where these conversations are going to go. But I had a really good conversation with my daughter today, of all people, and we were talking about genetics, and she asked a question about the adjustment and how the adjustment had anything to do with the environment that's upon the genetics, and so I thought it was a great question. I thought that she's been getting adjusted since she was 9 days old. She's 24 years old now. She's 24, yes, and she's been getting adjusted since she was 9 days old, and it sometimes it just takes a long time to figure this stuff out, right? And sometimes we do things. Remember, we talked about on Monday night. We talked about the when we were taking health to church, and we were talking about how sometimes we don't think about things, like we just go along with things, and we don't really think about them. We don't. In order to say that we believe in something, we have to think about that. You could just say it, but then I just think when it comes down to it, what you find out is that you'll just get blown here and there because you didn't think about it. And it's not necessarily fair for someone that young to, you go through your whole life and you just get adjusted because your dad's a chiropractor, and you're like, I don't really even know what that means. And you're just like, well, whatever, it's the only house I've ever lived in. So it's, I guess I'll just go along with it, whatever. I get that. But you don't really understand the depth of it. And so I've got an article tonight that I think that we should go through. And I know we've talked about this concept before, but I think as we go through this, I was really thinking about the way that we break things down by the filter. If you have a new thought that you're going to work through, you're going to filter the world through. You got a new way you're going to look at things. And it's like all of a sudden, if we talk about a new filter and then we decide, hey, we should probably go along with, we should probably take that filter and now read through something. We should take that filter and work through something. That's kind of what I want to do tonight. I want to take that and I want to walk us through the idea of the environment upon the cell and the practical things that go along with it. And I was thinking about how am I going to explain this that from a filter standpoint. And I was like, and I told Leslie, she's like, you need anything right before she left? And I said, yeah, I do. I need my red and green glasses. And I was like, okay, I'm going to put on my green glasses. For all you guys on the radio, I got my green glasses on. So we use these shades in the gym to stimulate one part of the brain over the other part of the brain. And according to our good friend Ian McGilchrist from the Master and His Emissary, the right hemisphere has an affinity for green. So we can kind of stimulate that right hemisphere a little bit by changing the filter that we're looking at. This is so they're pretty cool. I got some green sunglasses, and they're pretty cool. And when I put them on, it changes the filter that I see this room through. Now everything has a different color in the way that I see the room. But it's not just the color that's changing right now. It's also the affinity of my right hemisphere for green is it's activating the neurons in the right hemisphere. It's kind of activating the big picture thing. It's like, hey, you know what? This is stimulating my brain, in a different way. Can I feel that? No, not necessarily, but I just know that it's happening. And so that's one filter that we can look through, that we can start to see things through this particular filter, right? And then I could change it. I could take my green glasses off and I could put my red glasses on. And and now this whole room looks way different. I feel like I'm in some sort of a dark room now, and I feel like it's like I'm actually like this is kind of wicked, really. all the lights in the room are just like totally different. Everything that's dark is darker, and the lights have a totally different color. And I'm seeing the room in a totally different way because I put my red shades on. So I can switch them. I put my green shades on and everything brightens up. I put my red shades on and it's like crazy in here now. And I think that this is a great example for multiple different teaching points. But number one, it's a great example because it's changing my perception of the room, my physical perception of the room by wearing these glasses. Number two, it's changing the stimulation of my brain because these red glasses have a affinity. My left hemisphere has an affinity for red. So now all of a sudden, I've changed the way that I see things physically, and I changed the way that I interpret things by having these glasses on and firing that left hemisphere. And so what I wanted to do is I wanted to take the thought, those are pretty crazy, by the way. I wanted to take the thought of changing the filter a little bit, and then reading through an article that's just on back pain. And then back pain is not something that's all that inspiring to me, but it's something that we do. And I can tell you right now that those red glasses are still making an impact on on the lights from the room. I took the red glasses off, and now all of a sudden the room is way brighter. That light that is way brighter than it was just a few minutes ago. So even the after effect of the filter is still in place. So I want to, it's really cool because we can talk about some of this stuff, and we can just change the filter just a little bit, and then we can talk about the same exact stuff. And it's like, oh wait, I see what he's saying. If he's saying it a little bit different, and I see what he's saying. So we've gone through this PowerPoint on epigenetics before. And that was what the conversation was with my daughter. And I've had this with multiple people, but the idea of the environment upon the cell and the environment that's upon the genetics, because you'll get caught up in this idea of your genetics is what's driving your expression. You'll say, well, it's my genetics. I have this problem because my granddad had this problem and because my dad had this problem. And you could take a cell, and I don't know exactly how this is going to break down tonight. And you could take that cell and you can look inside that cell, and there's a nucleus inside that cell. And you can look inside that nucleus and there's a DNA inside there. And you've got this nucleus with your genetics on it. You got half of them from your mom and half of them from your dad, right? And we broke this down just recently. But the ultimate question of the night is this: how does the adjustment affect the expression of my genetics? That's the question that she asked. And so I'm gonna attempt to try to take the idea of epigenetics, and then I'm going to back it up into the question. And what does the adjustment? You're just popping my back. Like, what does that even have to do with anything? And this all comes from the conversation of what goes on in our family. that with the genetics that I got from my dad and the genetics that Caitlin got from me, and the whole ankylosing spondylitis problem that we have that runs through our genetics, and the whole manifestation. If you guys, you can Google that if you're interested in that particular thing, but and but it's a well, some people say it's an autoimmune disease, but I don't buy autoimmune diseases. I don't believe in that concept in a mistaking way. I'm not saying that the body won't attack itself, but the body's attacking something. It's doing what it's told to do. It's not making a mistake. That's where I don't believe in autoimmune. I don't believe the body makes a mistake. And you might have been told that before. You might have been told that you have an autoimmune disease and that's why your thyroid's not working, or you have an autoimmune disease and that's why you've got joint pain, or whatever your thing might be that you've been told, right? I just disagree with it personally. I just don't think that that's the body. I don't think the body makes mistakes like that. I think the body's being told to do something, right? So what ultimately we are getting in our family between my dad, me, and my daughter is we're getting inflammation. And the inflammation is the expression of the genetics. And there's this whole, and it's not 100%, it's not 100% tied into it as we go on. The things change, but for the most part, somewhere in our body, we have this HLA-B27 marker. We've got this marker that's inside of our body, the three of us. My dad had it, and his manifested itself into full-blown ankylosing spondylitis. Destroyed his life, basically. Okay? I had the opportunity back in my 20s to deal with it, and I dealt with it, and now I have this genetics, but I don't have this expression. And it's like, why is that? Why is that a thing? Why does the expression change in some people? How come sometimes it's due to, we say, well, it's just my genetics. And it's like, my granddad had heart disease, my dad had heart disease, I'm going to have heart disease. And it's like, well, some people truly believe that there's no options right there. And I just don't think, I'm not one of those people. I'm not one of those people that believes that at all. I think what it is the environment. And you've heard me say this before. I think the environment upon the cell is telling the cell how to respond, and then the cell is responding. I think this is affecting this, and I think this is causing this in some form or fashion. In some way, I think there is a environmental effect upon the cell, which is causing the cell to act in a certain way to manifest the expression of whatever would be appropriate for the cell to express in the environment that the cell is in. That's what I believe. And this was this was way simpler earlier today at lunch, and it was way too much already. I get it, because my daughter said, I just asked one simple question, and then you went off into this dissertation, and I was like, I know, but I wanted to give you the background of it because I wanted you to understand it, because it really does make a difference. It makes a difference in what's going on inside of our bodies. It makes a difference in how we're expressing things, because what you might not like the expression of what your body is doing. You might not like the expression of diabetes. You might not like the expression of cancer. You might not like the expression of heart disease. You might not like the expression of arthritis. You might not like the expression of abnormal movement. You might not like any of those things that you're getting. And you don't understand why you're getting them. And you just think that it's just part of life. You just learn to live with it. And you just say, well, that's all that I don't get it. Like, it's like, It's and that's sad to me that people live with the expression that whatever their expression is, they just say, "Well, there's nothing I can do about it. It's just runs in my family." And you may say that, and you may believe that, and you actually may be right. Maybe I'm wrong. Who knows? But I want to present this idea anyway, right? I think it's the environment, which now it's not the genetics, it's the epigenetics. It's the environment that's upon the cell. What does that mean? What does that mean, Jason? What does it mean when you say it's the environment upon the cell? It's the physical and the chemical and the mental emotional environment, what we call stress, upon the cell. The cell, see, like we take all this stuff and we wrap it up and we just keep going together, and it just becomes more clear if you just stay with it long enough. It just becomes more clear and more clear about what's going on. And it's been going on for a long time, and I've had multiple conversations today about what Robert Kennedy's talking about. And it's like everybody's saying, "Hey, like he's talking, he sounds like you." One of my old guys said, "He sounds like what you've been saying," and I'm like, "Yeah," and I got it from somebody else before me. Right? It's not a new concept. Wellness is not a new concept, but it's like, what are these physical, chemical, and mental emotional stresses that are acting upon this cell? Because what is the cell? What is this? What is happening with the cell? Remember, we've mentioned this multiple times. We've mentioned number one, the alarm, and number two, adapt. Right? The 5 stages of the stress response. First is the alarm. What is the alarm? What does that mean? What literally does that mean is the alarm? It's this physical, chemical, and mental emotional level of stress. This stuff right here is D.D. Palmer in 1895. Crazy fish salesman, they always say when they talk about it. The crazy fish salesman from Davenport, Iowa. Physical, chemical, and mental emotional stress. How in the heck did he nail that in 1895? I don't know, but man, he nailed it. It still holds up. There is a physical, chemical, and mental emotional alarm. There's an alarm in the environment. There is something out there in the environment somewhere, either in physical form, in chemical form, or in mental emotional form, that is expressing itself, that is influencing the tissue. It's influencing the cell. The cell, think about it. That's just a book. Your genetics is your owner's manual. Like I'm just gonna I want to know something. Like I've got these books sitting over here. Here's my Master and His Emissary book. It's just sitting here on my desk, right? Okay. It's doing nothing but sitting there. Matter of fact, it's been weeks since I've even picked it up. It's just sitting over there with my books, and now it's just sitting right here on the table. How long is it just going to sit there on the table? It's going to sit there on the table forever. Are any of the pages in the book going to be effective whatsoever? No. It's just going to sit there on the table until what? Until I reach down and pick it up. And now I open the book. And now I read the pages of the book. And then what do? I behave differently because of the content that I read in the book. Right? But I had to take action upon the book because the book just sat there. We act like our genetics is actively telling our body what to do. And it's like, no, our genetics is not actively telling our body what to do. Our genetics is responding to the environment, and then it's telling our body what to do. Like we're going to the genetics as if we're going to the owner's manual to try to learn how to live in the environment that we're in at the moment. So we've got this physical, chemical, and mental emotional stress. So now we've gotten this alarm. We've gotten this alarm, which is in the form of physical, chemical, or mental emotional stresses, or the combination of them all. The combination is a big key to this whole thing too, because it's not just them independently. You might be able to take a lot of physical stress, and you might be able to take a lot of physical stress and a lot of chemical stress. But if you load it up with physical stress, chemical stress, and mental emotional stress, you might break down. The combination of those things are very important in the big picture of things. And the question is, what are you expressing? Skip this whole thing and go to the expression part. I don't know what I did right there, but go over here to the expression part, and then ask yourself, what are you expressing today? And it could be anything. It could be knee pain, it could be back pain. We're going to go over that in an article in the second half of the show. It could be high blood pressure. It could be arthritis. It could be your foot hurts. I had multiple foot problems today. We had multiple knee problems today. We had multiple shoulder problems today. We had neck problems today. Then we had a bunch of wellness people today. It's great, right? So it's like, what is it that you're expressing personally? What is it that you're expressing? Do you have a problem? Do you have an issue of any kind whatsoever that you do not, or that you are not happy about the way your body is working? JT said it. He came in today. He's like, I said, how you doing, JT? He said, I'm better today. And I said, you weren't good today? I mean, you weren't good yesterday? And he's like, no, doc, the change of barometric pressure with the storms that came through, I wasn't feeling too good. But you know what I did? I just doubled up on my fish oil, and I feel great today. I said, JT, that's the best thing I've heard all day long. I was like, that's the same thing I tried to tell my daughter at lunch today. Like, change the chemistry. Change the chemistry around the cell. Change the chemical environment around the cell. What do you mean change the chemical environment around the cell? Okay, let's go to all the things that we know. What do we know about omega-6s? They're inflammatory. What do we know about omega-3s? They're anti-inflammatory. What is your expression? Your expression is inflammation, inflammatory. What should you do? What should you do to change the expression of the cell if you're dealing with inflammation? Should you increase your inflammatory chemistry around the cell, or should you increase your anti-inflammatory chemistry around the cell? Well, you should change your anti-inflammatory chemistry around the cell. How do you do that? You take your fish oil. You take your fish oil, and it does what? It adds EPA to your body. And what does EPA do? It balances your arachidonic acid. And what is arachidonic acid? It's the precursor to inflammation. And so what you're getting in expression. Now, how does this whole thing work, right? It's like there's chemistry in the body, and we are constantly putting ourselves in an environment that's incongruent with the health. It's an alarm. That's what Robert Kennedy's talking about. He's talking about the food dyes and the sugar and the things. Like he's talking about yesterday, he's talking about the food dyes that we know are chemically wrong in the human body. We know that taking these food dyes into our body changes the chemistry of our body and causes an expression that is not helpful to the body. And he's saying, when my uncle was the president, we had 3% of the kids had chronic disease. And today we've got 60% of the kids have chronic disease. What the heck happened in between 1960 something and 2025. What happened in the environment? What changed in the environment that caused this increased amount of chronic disease in children when it didn't happen before? There has to be something in the environment, right? And that's what he's saying. He's saying that there's a chemistry that changes the expression of what goes on in the environment. Does that make sense? I hope that makes sense. I hope it's like, what? Wait a minute. You're saying that if I drink this carbonated water that's full of high fructose corn syrup, a soda, and I eat a French fry that's deep fried in vegetable oil, that's already going to make my insulin levels spike because it's a white potato. So we're going to get a quick glycemic load. We're going to get sugar to the bloodstream fast. That's what glycemic load is. And I'll say it one more time just so everybody else really understands it. I really hate diabetic doctors. I had a guy come in this morning and tell me, I said, "How you doing?" He said, "I'm good. I went to see my diabetic doctor and he said, everything's great. Got a good report from my diabetic doctor." I'm like, it's like, dude, it's just straight to death. You can, whoa. Sorry, didn't see the break. Type 2 diabetes is 100% reversible. You got to quit eating the refined carbohydrates. You got to quit getting the quick glycemic load, right? Let's take a break. About to get fired up on that deal. Let's take a break. We'll be right back. You guys stick around. This is Life with Jason Clemens, DC. We're talking about epigenetics and the environment tonight. We'll be right back. Well, what's your A1C? 6.5. Okay. What's going on in your liver? What's going on with centripetal obesity? What's going on with the fact that your skin won't heal? You got diabetic, we got diabetic sores that won't heal. Why won't they heal? Because the body's in the environment that's incongruent with health. That's why they won't heal. So what are we going to do? We're going to take steroids, and steroids are anti-inflammatory. We're going to take steroids so that we can try to heal the sores that we're having on our feet and on our arms, because we're not healing properly, right? But we got a good report. We got a good report from our diabetic doctor. But what'd you have for breakfast? I had a sausage biscuit with egg. Okay. Did you eat the biscuit? I did. Why? What did you do with that? What'd you do with those French fries when you ate that burger and those fries and you ate that bun and those fries that were dipped in vegetable oil, which is inflammatory? They turned into trans fats. They're high on the glycemic load, and you're like, well, that's chemistry. That's the chemistry that changes the environment, that changes the expression, that ends up in some sort of ability, an attempt to adapt by the cell, which now, because it's an alarm. So now the cell is trying to adapt. And now because the cell is trying to adapt, what will happen if it can't adapt? What's the next thing that we all know is on the list when we lose the ability to adapt? 3, fatigue. The cell's going to get tired. And after the cell gets tired, the tissue's going to get tired. And after the tissue gets tired, the organ's going to get tired. And after the organ gets tired, the organism is going to get tired. So you are going to say, "I'm really tired." When you say that out loud, if you ever say that, if you say to yourself, "I'm just really tired. I get really tired really quick. I fatigue really fast. Just seems like I'm tired all the time." If you're saying that to yourself, what are you saying? Physically, metabolically, biochemically, what are you saying? You're saying you had an alarm that you tried to adapt to that you could not, right? That's what this stuff means. Hey everybody, we're back. This is Life with Jason Clemens, DC. We're talking about the environment. We're talking about epigenetics. We're talking about, eventually, what does the adjustment do to the environment, right? What is happening inside of our body, right? So we've got this expression that we don't like. Something is wrong inside our body. If nothing's wrong, and you like your weight, and you like the way you feel, and you like the way you sleep, and everything is fabulous, then probably what you're doing is putting yourself in an environment that's congruent with health, or pretty close to being congruent with health. That means your physical, chemical, and mental emotional stresses are adaptable. Your body has the ability to adapt. It can change. It's not that drastic. Your environment is not that complicated that you can't adapt to it. So you're adapting really well. All your markers, everything that you can possibly measure is falling within a normal frame, and you're like, hey, I'm doing good. Your blood work is good. All your markers are good. Your subjective and your objective complaints are good. You're either really young and fit or you've got yourself in an environment and you're doing pretty good with it. Like, there's no sense in changing that environment. If you're rocking and all of your numbers are great and all of your things are great and you've got all energy all the time and you just can do whatever you want to do, you are doing well. You should just lean into it and enjoy the fact that you're doing well. You don't need a new regimen. You don't need a new supplement. You don't need anything. You're doing great. This that you're probably not listening to me. You're probably not listening to me right now, right? Like, if you're doing that well, you're probably out there moving and shaking and doing something, right? But we're talking about health, and we're talking about health to the people that might want to improve their health. And you might want to you might be doing great and still want to improve your health. And so you come and listen to this show. I mean, that's awesome. But you might not be doing as well as you could be doing, and you might not be doing as well. Your family members might not be doing as well as they could be doing. And you might say to yourself, hey, you know what? I think we could do better. Like, I think we can actually improve our health. So get this idea of the environment upon the expression. It's like, what am I expressing? Am I expressing anger? Am I expressing anxiety? Am I expressing pain? Am I expressing fatigue? What am I expressing? Lack of concentration? Right? I can't remember. I got a bad memory. All those things are expression, right? It's not just about pain. It's about, like, are you chill? Are you pretty calm most of the time? You roll with the things, you handle the things, right? You've got a good purpose, you've got goals, you can move forward. Or do you have any of these things? All of these things to me are expressions. Um, kids kids deal with this stuff all the time. It's like, let's just take a child. Let's take this same exact thing. Let's actually clear this out, and let's take a child, and let's just draw that cell back here, and let's draw that nucleus back here, and let's put this DNA right back in there, and let's talk about environment, and let's talk about expression, and let's talk about ADD in a child. What is attention deficit disorder? If that is a thing, what is attention deficit disorder in a child, right? It's an expression. That is an expression of the way that that particular child's body, brain is functioning. It's an expression. Now, if we really understood health, and we really understood that this expression is what we would call a symptom. It's like, okay, a symptom of what? What is it a symptom of? It's a symptom of the environment, the physical, chemical, and mental, emotional environment of the child. That's the symptom that's going on right now. The child has ADD. Why? Why does the child have ADD? Right? The chemical imbalance. That's what they're going to tell you. Somebody that's trying to sell you drugs is going to tell you your child has a chemical imbalance in their brain, and that's why they have ADD. Maybe 0.05% of those people, some low percentage, right? Maybe that could be the case in very low percentage things. Okay, fine. That's fair enough. I'm not saying there couldn't be somebody on that continuum that falls into that realm, but that's not the majority of kids that are dealing with ADD. There's something in the environment that's causing that to happen. So if we really, really loved that child and we really wanted to be good parents or teachers or coaches or anything that had anything to do with the child, and we really did care about that child, we would try to figure out what in the environment is causing the expression of ADD. And then we would work on improving that environment. Right? Wouldn't that make sense? That's not like, I don't think that's blasphemy to say something like that. I don't think it's all that crazy, really. And you could take every single expression. You could take old people and Alzheimer's. You could take young people and whatever you want to take. You can take middle-aged people in memory. You can take whatever the symptom might be in the expression. Now, if you're expressing awesomeness, then you're probably got yourself in an awesome environment. Does that make sense? Fair enough. Keep at it. Right? Okay. So let's change gears for a second, and let's pull up this article, and let's just walk through a couple of these thoughts, and then we'll walk through them in a way that not because I'm all fired up about this particular article, right? This is Dr. Murphy just posted this one today, I think. Nonspecific low back pain. The New England Journal of Medicine, May 5th, 2022, volume 386, number 18, pages 1732 to 1740. This is done, the study cites 54 references. Okay, this is a study about nonspecific low back pain. But I don't want to read it. I don't want to read it with nonspecific low back pain. I want to read it through my green lenses. I want to read it through the idea, my lens, if I can even read it with this. I'll try to read it like this. I want to read this. I want to read this article with epigenetics as my lens, and I want to walk through as many of these sentences in the time we got left on the show, and I want to think about it from an epigenetic standpoint, and I want to see what they're saying. And I'm going to go through here. Typical nonspecific low back pain case presentation. Low back pain and stiffness for weeks to months. Weeks to months. Let's just start right there. That's what we're talking about, right? Weeks to months. Why? Because we had an alarm and we tried to adapt, but we can't adapt. So what are we're doing? We're fatiguing. And what is one of the signs that we're fatiguing? We've got stiffness for weeks to months, right? It's like, wait a minute, why do I have stiffness from weeks to months? This has now become chronic, right? The pain is worse getting up in the morning. Okay, why? What is that? What is the pain worse getting up in the morning? Let's go back. Let's go back to our board. Let's go back because we actually had this conversation this morning or when I had lunch with Caitlin. All right, here's you got the brain. See if I could do this without my glasses on. You got your brain and you got your vertebra, got your sacrum, and you've got your back pain down here somewhere at the bottom, okay? You've got the two different kinds of nerves that are carrying information they're carrying information into the spinal cord and they're carrying it into the brain. But let's kind of draw it like this. And then let's draw this one like this. And then let's say that we got this one and it's getting to the brain. Okay? We've got, it was really funny because when I was breaking it down, she was telling me, we've got the type A fibers and we've got the type C fibers. And the type C fibers carry the pain. And the type A fibers are movement. So we got the two fibers inside the one nerve fiber that's firing into the spinal cord and into the brain. If the pain fiber gets to the superhighway called the spinal cord first, it's going to hit that superhighway and it is going to shoot into your brain. Right? Now it's going to get there. So we have an ability, healthy people inhibit, we have an ability for the type A fibers that only fire with movement to inhibit turnoff. If they get to the spinal cord first, they come over here and block the C fibers. They block, there's some inhibiting going on, okay, with the A fibers. Movement inhibits the pain. So now, if we're moving, we're dampening the pain. But when we lay down and we go to sleep and we don't move, what happens? These movement fibers quit firing. And then what happens? The pain gets to the superhighway and to the brain, and there we go. Right? So now what does the brain perceive? Pain. It's up there. So what does the article say? What is the article saying? I mean, we hadn't even got through 2 sentences of this article yet, and now we're already starting to see it in a totally different light. I'm really seeing it in a different light by wearing these green glasses right here, right? We've got stiffness for weeks to months, and the pain is worse getting up in the morning. Why is it worse getting up in the morning? Because we haven't been moving. And because we haven't been moving, we haven't been inhibiting that pain, and that dude's just been sending those fibers, that information all night long into the brain. It's like, oh, crap. Now we get up and we try to move, and the brain has already mapped it back out. We sent the information from the low back into the brain, and the brain maps it out inside of itself, and it says, okay, I know exactly where that hurts. That hurts right there. And now it's sensitized. Now those nerves around there are sensitized because they're not moving. The nerves aren't moving. The joint's not moving. The tissue's not moving. The fascia's not moving. We're not moving. And now that constant nociceptive information, that constant chemical firing irritation that's going on because those tissues are not functioning properly for whatever reason, physical, chemical, and mental, emotional, they're not firing properly, so now we're getting this pain, right? A history of episodes of low back pain that occurs with vigorous sports activities. It's been happening for a while. We've been in an environment that's incongruent with health for a while. Other medical history is unremarkable. Physical examination shows reduced lumbar flexion. Physical examination shows reduced lumbar flexion. Reduced range of motion. I have lost the ability to move. Now I'm trying to move my lumbar spine, and I can't move my lumbar spine. I've lost the ability to move. And what's that doing to my brain? I'm losing input. Remember, full range of motion on one side versus half range of motion on the other side. And it's like, that's a difference in the brain. If my right finger is only going through a half a range of motion and my left finger is going through a full range of motion, there is a difference between those two joint inputs. And remember, we've got 3 trillion bits of information per second, but not if this joint is only going through 50% of its motion. If it's only going through 50% of its motion, it's decreasing that 3 trillion bits of information per second. Why? Because full range of motion sends different pieces of information to the brain than half range of motion does. Decreased range of motion. Man, I'm stiff. When I try to turn my head, I can't turn my head in both directions. It's really hard to turn my head over this way. I can turn this way a long ways, but man, it just hurts to turn this way. That's changes in input into the brain. It's physical, that's physical, and you can get into chemical, and you actually could get into mental emotional at the same time, but that's physical alterations in the input into the nervous system because it's decreased range of motion. And what do these people have? Physical examination shows reduced lumbar flexion. So what is happening? The reduced lumbar flexion is changing the environment around the cell, which is also changing the environment in the brain. It's like there is tenderness on palpation of the low back. Yeah, because those C fibers are fired up and sensitive because they're not working properly. There are no neurological deficits. Bull, corn. That's one of the biggest problems that we have. There's no neurological deficits, meaning that maybe we don't have any nerve root compression and wasting away of our calf. That's fair. That's fair enough. Maybe we don't have weakness in our leg because of this low back pain. That's what they're saying when they're saying neurologic deficits. But they're talking about downstream. They're not talking about upstream. You're telling me that there's not a change in the neurology if you've got sensitive tissue, sensitive nerves, decreased range of motion, constant stiffness, multiple occurrences of this problem over time? That's not true. That bullet point right there, that is deceiving a little bit. They don't mean anything by it. These guys, Alessandro and those guys, they don't mean anything by it. They're communicating a thought with some words that can be taken in multiple ways, and that's what I just took them in. Okay, so if we go through here, right, low back pain is with or without leg pain is worldwide the most prevalent and most disabling of the conditions that are considered to benefit from rehabilitation. It goes down through here and it says this: non-spinal causes of specific low back pain. Now listen to this, because this is really important to what we're talking about tonight. Non-spinal causes of specific low back pain include hip conditions, diseases of the pelvic organs. Now, why would they say that? Like prostatitis or endometriosis. Non-spinal causes, this is non-spinal, not non-specific, non-spinal causes of specific low back pain include hip conditions. Your hip can contribute to low back pain, and diseases of the pelvic organs, meaning that there's a organ-muscle function relationship. Viscerosomatic is what we call it, or somatovisceral. That's what we call it. Those are the two ways that it's either the somatic nervous system affecting the organ, the muscle affecting the organ, or the organ affecting the muscle. We talked about AMIT last Friday, and we talked about organ reflex points. So, and we talked about how the gallbladder refers to the right shoulder, and the heart attack refers to the left shoulder, and menstrual cramps during a period causes low back pain. Kidney stones cause low back pain, right? There's another example of taking in. Now, what do we just do by understanding just that one part of that sentence? Just by understanding that one part of that sentence, what do we just do? We took in the concept of the organ health relating to the muscle function, all of those things that's going on up there. Non-specific, typical non-specific low back pain can case presentation. Okay, it presented with stiffness for weeks or months. It presented with pain when you get up, worse pain in the morning. It presented with episodes of multiple problems. It presented with physical examination with reduced lumbar flexion, right? All of those manifestations, those expressions, now are related to organ function and health. So what do we just do with that? When you can understand that right there, and you can say, man, I see what he just did right there. Like, wait a minute, my liver health might have something to do with my lumbar flexion. Yes, that's what this article is saying from the New England Journal of Medicine. The real doctors. It's saying yes, that my liver health might have something to do with lumbar flexion, and we've already made the point that's perfectly clear that decreased lumbar flexion changes your brain, right? Okay, now my liver health. So now let's talk about all the possible things that could possibly be affecting the liver. Let's go through the physical, chemical, and mental emotional stresses of the liver. Let's go through fatty liver disease, and let's go through cirrhosis of the liver, and let's go through fructose. Now, wait a minute. Wait a minute. Did you just say that drinking my orange juice in the morning might cause brain changes because my low back might lose its range of motion due to the fact that my liver's not functioning properly from having to process all that fructose? Yep. That's exactly what I just said. But you already knew it, right? You had already beat me to the punch on that. You knew it already. It's like diseases of the pelvic organs, diseases of your organs changes the function of your body, and the function of your body changes the function of your brain, and the function of your brain is going to dictate whether or not you can express wellness. Systemic disorders. Spinal causes include herniated disc, spinal stenosis, fracture, tumor, infection. Yeah, all that stuff that we knew, right? There is some controversy regarding the term non-specific low back pain, since structures such as muscles, joints, or disc, or a combination of these, may be causing the pain, but are not readily identified by means of history taking and physical examination. Okay? Structures such as muscles, joints, or disc. Now we're talking about joint function. Joint function. Okay. What are the two things that I always, or the disc, what are the two things that I always talk about when it comes to disc degeneration? We talk about two things, right? We talk about number one, abnormal biomechanics, abnormal movement of the joint, or number two, abnormal chemistry, right? The abnormal chemistry in the joint, the imbalance between the omega 6-3 ratio, the abnormal chemistry in the joint is affecting this issue. And we started this whole thing to answer the question, Dad, how exactly does the joint, how does exactly does the adjustment alter the genetic expression it might alter the expression that I'm dealing with this particular autoimmune disease? That's the question. And it's right there. It's right there because what does the adjustment do? It does multiple things. And I know you're talking to a chiropractor, so you're going to get adjusting ideas, right? But what does the adjustment do? It moves the joint. It changes joint biomechanics. It puts the joint through the full range of motion. So when the joint is going through partial ranges of motion, we take that joint to that end position and we add a little force to it. That's what everybody loves, is that popping sound, right? We add a little force to it, and now what happens? The joint now has an increased range of motion after the adjustment. The joint does, right? What else takes place? We change the chemistry around there. There's an alteration in the chemistry around the joint whenever the joint is adjusted. What else takes place? So number one, we've got movement. Number two, we've got chemistry. And what else happens? It changes the neurological input into the brain. That's the most important thing for me. It changes the neurology. When you adjust someone, you change their neurology. And we broke it down last week with the activator article, and we're talking about how when you get adjusted with the activator, the salivary amylase changes and the glucose changes and all kinds of stuff changes with an adjustment. And so the adjustment part of it is telling the brain, this is a joint that needs to move. What we're doing for the cells, from the cell standpoint, is we're telling that cell in an environment specific thing that this is a moving joint. It is not a stationary joint. It is a moving joint. So what is the expression that we want this cell to do? We want this cell to treat this joint as if it's moving. It's mobile. That's what we want we're like, whoa, hang on. The cell's going to say, wait a minute. This cell's not supposed to be, this joint's not supposed to be stuck still. This joint's supposed to be moving. I was trying to weld it shut. I was trying to ankylose it. I was trying to put a whole bunch of calcium down on top of it, bone spurs and all this stuff, because I thought it was a immobile joint because it hasn't been moving properly. And it's like, no. It's not an immobile joint. It's supposed to be moving. And then the brain's like, oh, whoa, hang on a second. That cell's like, wait a minute. I need to stop treating it like it's immobile, and I need to start treating it like it's mobile. And it changes the genetic expression around that joint as well. I'm out of time, y'all. We'll be back tomorrow night at 6. You guys have a great evening. I hope that makes a little bit of sense right there. You get an adjustment. You change the joint dynamics. But you also change, it's not just the joint dynamics. It's the brain dynamics. It's the chemistry of the whole thing. You change all that stuff at the same time. And then you alter the genetic expression of the joint. That's why when I was 20-something years old and I got the diagnosis from my medical doctor, and he didn't make the diagnosis, he said, look, you're 20-something, you've got sciatic pain, and you've got HLA-B27. You're probably going to manifest ankylosing spondylitis. That's the same thing they told my dad when he was 20-something years old. Here's your problem. You've got ankylosing spondylitis, and here's what you can do about it. Take aspirin and don't play golf. That's what you can do about it. So what did my dad do? He manifested the disease that they told him that he had after he got the diagnosis of the disease that they told him that he had. What was the difference between the two of us? I had a different environment. I was like, thank you very much for that information, but I'm not doing that. So what did I do? I went straight over to my chiropractor's office, my brother-in-law, and said, hey, dude, I'm not manifesting that. Someone else, like, I don't care what we have to do, but we have to change the environment of my spine. And that's when I started getting adjusted, and sometimes I get adjusted and go into spasm, but I don't have ankylosing spondylitis 30 years later. And that's what I was trying to explain to my daughter that has the same experience. She's got the same genetics. I was trying to explain the same thing to her. You can take the genetics and you can manifest the disease, or you can take the genetics and you can epigenetically change the expression of it and not manifest the disease. And that's a choice in a lot of cases. And in this particular case, I know for a fact it's a choice. It's up to her which one she wants to do with it. And she's working on it, and she's listening, and she is receptive, and she's trying. And all those things it's something she's going to have to work through, just like there's things that each one of us have to work through. But that's the way it works, I really believe. And if we really study it and all these things, we start to understand, man, I can change my expression by changing my environment. That's all I got for you. I just wanted to carry that on until we finish that up a little bit. I hope you guys have a great evening, and we'll be back tomorrow night at 6. Thanks.